Kumar, Chief Clinical Officer for Hartford Healthcare. I'm here to update you regarding some of the details regarding the cases and other happenings across the Hartford Healthcare. And I'll be joined with my colleague, Dr. Eric Walsh, after that. He's a medical director for the Go Health, our partner for urgent care for Hartford Healthcare. So we'll start with some numbers here. Bacchus Hospital has 9 patients who are positive. Charlotte Hungerford has 15 patients. Hartford Hospital has 139 patients. Midstate Medical Center has 17 patients. St. Vincent has 74 patients. Hospital Center Connecticut has 48 patients. And Wyndham Hospital has 2 patients. Total 304 patients across the Hartford Healthcare acute facility. As indicated yesterday, we are seeing a gradual decline. Which is a good thing to manage non-COVID related illnesses as well. With the healthcare system is stressed by COVID or pandemic of any kind, allows us to do the things we are doing consistently. However, as you know, notice that the state numbers are still on the rise. We are still adding some more active cases in our numbers, and we continue to see increased number of mortality as well. So I always put this caution. We're still not out of the woods. There's still a journey to go through as we progress at this time. So we indicated yesterday was the beginning of the Nurses Week, a wonderful celebration for all the wonderful members of the healthcare community, the nurses who take do amazing job every single day and night across the system, across the country, across the state. So very thankful for all the. Also, we had a Javier Colon who came to Hartford Hospital at a surprise concert yesterday. Governor Lamont was able to make it, along with our CEO and President, Mr. Jeffrey Flax, and Lieutenant Governor Susan was there as well. Special thanks to Renee DiNino and iHeartRadio for hosting the event. That was very well received by our nurses and our colleagues, and these kind of gestures really go a long way of uplifting their spirit and creating a positive environment around us, as we can always need more of that. Hartford Fire Department also brought some droppings for lunches. Thank you very much. And Premier Limousine for cupcake donations. They're all wonderful support from the community. It's so good to see this during these times. You know, our healthcare teams truly appreciate that generosity and support by all who are donating, and your time in media as well, who's reaching out every single day and writing about what people are doing. So I appreciate that as well. I know you have a tremendous responsibility in this journey as well. We've talked about this testing. We still continue to expand our access. We're going to continue to do so as we go forward. We've had almost about 204 plasma donations across the system. As I indicated, generally it's a part of the research protocol under the Mayo's guidance. But at the same time, our clinicians are telling me they're seeing a positive results. They're excited about that. So that's a good place to be. It's anecdotal. I wouldn't call it as a conclusive evidence without the research being completed, but that's where we are right now. We continue to expand our telehealth visits. We've had more than 72,000 across the state. And we are reaching out and creating more access points for our patients to seek care. As indicated yesterday, we are the new normal we're going to be living in with COVID and non-COVID patients in our system and across the healthcare institutions throughout the country. In Hartford Healthcare, we are making sure that we create an environment as safe as possible. We're doing all the things we can do to care for the patients as they come back to seek care, which they might have postponed for some time. So we are open, we're ready, and we're here to support at this time. With that, I'm going to introduce my colleague, Dr. Eric Walsh, Medical Director of Hartford Healthcare Go Health Urgent Care. Dr. Walsh.
Hello, can you hear me, sir?
We can. Thank you. Carry on. It's all yours.
Well, we just wanted to give an update on some of the things we're doing here at Go Health Urgent Care. We are here for the community and have been since the onset of this pandemic. We've maintained open doors in our centers. We have 18 centers across the state. There are 13 operating right now. And anyone can come in. We use universal precautions. We just ask that when they come in, everybody wears a mask, and a lot of times they'll take turns coming into the center from their car, and we'll call them to bring them straight back to a room. The exciting news that we have now, of course, is that we are doing antibody testing, and this is for IgG antibodies. There's a small blood draw that's done in center at the Go Health Urgent Cares. Can also be done at Quest, and this will detect the presence of COVID-19 antibodies. And so this is something that a lot of people have been asking us about because they want to know if they've had the virus in the past. And so, because over the last 2-3 months, many people have gotten sick and didn't get an acute test with the PCR mechanism. So this test is used very cautiously. If it's positive, it is likely that you've already had the coronavirus or that you were infected and may have had either subclinical or even clinical symptomatic presentation of the disease. And so the presence of antibodies does tell us that. What it does not tell us is whether or not you are immune going forward, and if you are immune, how long you are immune. And so the other part of this is that we are counseling people to continue to use all of the precautions around social distancing, wearing masks in public, and all the other things that we've been doing, hand washing, face touching, all of those different types of things. The turnaround time for the test is between 48 and 72 hours. We have, in the first week of doing this, seen them coming back in 24 hours. So Quest, our partner, has been doing a phenomenal job. The test is for those 18 and over for right now. And of course, anyone can come to any one of our Go Health Urgent Cares that are open, the 13 that are open to be tested. Now, one of the big things around this is whether or not this means that, as Dr. Kumar just mentioned, plasma donations can be done. We will kind of give you a connection to go to where, if you're positive for antibodies, where they can do further assessment and see if they can, if your plasma is good to be used to try and help somebody else, which is awesome that so many people want to do that. Again, the test is a serology test, a blood test, antibody testing, and the cost of the test for most individuals, if you have insurance, there's no out-of-pocket cost for pretty much most everyone with private insurance. The co-pays have been waived. For Medicaid or Medicare, same thing. There's no cost for the test. And this will give us valuable information from a public health standpoint to get an idea of how many people have actually been exposed or infected. Down the road, that information will be very important. Some of the other things we have going on, and then I'll open it up for questions and then return it over to Dr. Kumar, is that we are working on a back-to-work program. We know that that's going to be a big thing once the state reopens, and so we're coming out with a back-to-work program where employers can send their employees into the Go Health Urgent Care centers, and we do some testing and other counseling around going back to work. And we also have the acute swabs can be done in drive-through in our Avon, South Windsor, and our New London centers. For some of those that are acutely ill, there's a drive-through. We can order that through a virtual visit. You can go to our website, get a virtual visit, drive through, and actually be swabbed and know if you acutely have the virus. So with that said, I'll open it up for questions, and then we'll return it to Dr. Kumar.
Thank you. We'll open for questions at this time. Emily, you're the first one. Yeah.
From the current,
Emily's always the first one.
Oh, sorry.
No, I said Emily's the first one. I knew you were going to call.
I wanted to ask about the antibody testing. Do you know how many people have been tested at those 13 sites so far? And are there any restrictions for testing besides the age?
Right now, we've done over 300 tests this week, and that's climbing constantly. So, by end of the day, I would assume it'd be up over 500, maybe even 600. So we've done quite a few in the first few days of launching, and there really is no restriction. If someone is acutely ill, we want, you really should wait like 2 weeks from the onset of symptoms to give your body a chance to make the antibodies. But what we're finding as we're talking to patients is that many of them were sick in February or March, or even late January, and they wonder if then they were exposed. And what we do for a lot of those patients is we'll order the swab for the acute test to see if they have the virus now, and we'll draw the blood to get the antibody test, and kind of gives a more complete picture of where they are in regards to coronavirus.
Thank you.
Bridget, you're generally the next one.
Okay, I'm here. It's Bridget. Where are the sites for those testing locations, and how do people sign up for that?
Okay, so good question. There are 13 sites, and so Enfield, Windsor, South Windsor, Vernon, Glastonbury, New London, Wethersfield, Southington, Meriden, Avon, Torrington, and Bishop's Corner. And then we have at 3 sites, you can be swabbed for the actual PCR immediate, meaning the acute illness test. And that one, those are at South Windsor, Avon, and New London. So those are those 3. And then you had another question in there. I'm sorry.
How do they need a doctor's authentication for that, or can they just call and sign up?
Yeah, so what happens is they will need an order from a physician or a PA or a nurse practitioner. And there are 2 ways to get it. You can come into the center. We will see you, get your vital signs, check you in, do a quick visit, ask some questions, and order the test, and it'll be drawn right there. You can do a virtual visit and get the order, and then you can go to either Quest Labs and get it drawn if you don't have any symptoms, or come into one of our centers. But you can go onto our website and actually reserve a spot at one of the 13 centers, and then go in at that time and get the visit done and the evaluation, and then have the blood drawn and have the test done.
And what is the phone number for people to call?
Of course, you would ask me that. I don't have my card in front of me.
Bridget, how about we send you this information regarding the centers? Yeah, and we'll send you the information. Thank you. Any other questions?
This is Emily again. I wanted to ask a bit more about the Back to Work program. So what is involved in that testing?
So if you're part of an office that has been closed and you're about to open up and everybody's going to come back in, we can literally do the acute test and the antibody test. And as we learn more about the immunity of this virus, the antibody test will actually become more and more valuable. So if you have antibodies, and let's say we find out later on that you're immune for it means immunity for longer than 6 months. Then we would know that, you can go into the office and you won't, you're not going to be as susceptible as others, and you're less likely to spread the virus. So we would be able to tell you that. But for right now, while we're waiting for that information, we would be able to say, okay, this person had it. They're more likely to have some immunity because they have positive antibodies. But what we can say for all the other employees is you don't actively have the coronavirus. So people can go back to work and say, I had a test and I'm negative. And of course, that's a one-time thing, it's a spot in time, but it might make people feel more comfortable at work knowing that, pretty much everybody was tested, nobody tested positive. So we're here working, we're still practicing our social distancing, still wearing masks, hand washing, all of those types of things. But we go back to work with kind of a little bit more peace of mind when we start kind of at zero. And, obviously there may be some periodic rechecks of labs depending on the employer that we would also be able to do.
And for the acute test right now, are you using the rapid turnaround, the 15-minute test at all, or is this all the traditional acute test?
It's traditional. The Quest is really good. We usually get our results back, like I said, within 24, 48 hours. They're actually faster than we've been saying. And because, the way it works, we don't have a treatment yet. 15 minutes or if we tell you the next day, for most of our patients, that actually works really well because a lot of them are symptomatic. So they wouldn't be going back to work that day anyway. So it works for those patients that are asymptomatic and have gotten over it. Now we have the extra advantage of the antibody test as well, but we don't have the rapid test. I know Hartford Healthcare is possibly, and Dr. Kumar can correct me if I'm wrong, using that inside the hospital, but that one is really valuable for us if we have patients going in to the hospital or surgery or something and want them cleared to know that they don't have the virus like in a more immediate fashion. In an outpatient setting, the 24 hours is probably enough in terms of helping people figure out if they should go back to work or can they go back to being a caregiver for someone who's even more vulnerable.
Thank you. And Dr. Kumar, is that accurate that the 2-minute test is being used in the hospital?
So there are two different types of testing, which are the rapid testing. One is what we call the Cepheid platform. That is very accurate test that has been validated very well, that has very high sensitivity and specificity. We're using that test at the moment for patients who are going for urgent procedures or urgent surgeries and things like that to make sure that the staff is protected, and obviously we know the results on that. That test is excellent, but unfortunately we have a limited capacity on that, so we use it for urgency only at this time. The second test, which I think you're indicating, is of Abbott's platform, which is being rolled out and was in the media 2-3 weeks ago, which is a 15-minute small deck you can place somewhere and hopefully do the testing on that. We have those capabilities, but we have not rolled it out yet. The reason is the validation. We still are concerned about the high number of false negatives in that testing. So we're not using that as of right now, but we do have the capability of getting there.
Thank you.
You're welcome.
Dr. Kumar, Bridget again. Just to go back to the physiology of COVID-19 for a moment, one question. It seems to be that the mysteriousness of the symptoms, that the elasticity of the lungs comes into play a lot, and that seems to be what's protecting children quite a bit when we get the carbon dioxide building up in the fluid, blocking the alveoli, and oxygen not being able to transfer. Can you comment about that just the elasticity of the lungs and the compromised condition that can make this worse?
Yeah, so let's go back. So I want to start with that the very small percentage of people who actually get infected with COVID-19 gets really ill. Okay, a very small percentage of that actually eventually die. And when I talk about the very small, the studies out there, 3% rate has been quoted as a mortality number. Now, 3% is based on the number of testing we've done. The denominator is really important. The larger the denominator, the percentage will probably go down.